Okay, so this is a great and amazing question. I want to answer it as thoroughly as I possibly can. So I'm going to pull up a chart that I have been working on for a little bit to kind of help explain the different areas that, from my vantage point, I see in the healthcare industry. Um, and if I miss anything, for those of you that work in the industry, for those of you that are familiar, please let me know so I can update the charts. But yeah, let's get into it. Okay, hey, this is the current setup of the video. So here I'm going to do my best to explain different areas within the healthcare administration that you could potentially work in. And I want to start up obviously with the most common ones, the most prominent ones, and the ones that really come to mind for most people when you say, oh, I major in healthcare administration. So, first off, we have to start with patients and consumers. And I'm starting here because they simply are just the most important in this entire conversation. When we say, oh, I'm working in healthcare, what you're saying is I'm stepping into a field where it is paramount how we treat patients, where we want to provide patients better care, better quality, better access, better affordability, all of that stuff. And so if you are coming into healthcare without that perspective, without that priority already set in your mind, then you might be going into it for the wrong reasons. And I just want to make that super, 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 super clear for everybody, especially for administrators. It's very important for us to maintain the morality and the heart of this industry, and not get too business, not get too obsessed and consumed by the business side of it all. And so I really want to make that clear. But let's go into the areas that are probably most common for people to know and think of when they say healthcare administration. Number one is going to be servicers. This one is important. We need servicers. We need hospitals, clinics, urgent cares, emergency rooms. We need all of these different types of places where people can receive healthcare services. So this is very common for people to become administrators in the hospital, department managers, or they could even work for a hospital but in another department like finance, like HR, like patient safety, community health, government relations. There's so many things that go into hospitals and servicers that is still considered healthcare administration because it's just the business side of healthcare. So there are a lot of options there. Number two is that you can work directly with providers. More so, this is going to be like your physicians groups, your IPAs, your medical groups, where you may be helping doctors, nurses, etc., with the administration side of them providing care to people. So that's another option. And then another really important one that you will probably hear if you are taking classes right now is payers. And payers is just going to be the insurance side of healthcare. And of course, we all know that we have different insurers. We have Medicaid, Medicare, we have government insurers, we have private insurers, we have employer-based insurance. So a lot of different areas in there that you could work in. You could work for CMS, which also acts as a regulator. So I'll go ahead and switch over to our regulators. Regulation is really cool because in a lot of these other areas in healthcare, do you feel like you're limited by the rules of the game, right? You're limited by what people say you can do, what the law says you have to do, right? You have to submit all this data and all these records and do audits and be accredited and all this kind of stuff. But regulators are the people that are doing the audits, right? They are checking, they're keeping hospitals in check, they're keeping providers in check, to make sure that things are up to par, that you're actually employing the best practices, that you're actually providing good quality care of services. And if you're not, then regulators often are also enforcers. They're often also the people that say, if you're not up to par, then these are what your consequences are, and we're going to hold you to that. So that's one really cool field. And with regulators, they depend on researchers and educators. Now, these are not like strong areas in healthcare, but they still exist and they still are very important. So together, I guess they would be number 5. Researchers and education. These can be your academic institutions. Like if you've ever heard of academic medical center, like let's say UCLA is an academic medical center, right? One arm they're doing research, one arm they're doing education. On the other side, they are actually a servicer. They have hospitals where they are providing healthcare services. They're technically employing providers to provide services in their hospitals, in their clinics, right? And so you can see very quickly how a large health system like UCLA can actually encompass many of these different areas, all underneath one very large, very big organization. And then another area we have here is suppliers and manufacturers. These people are very, very, very important. If you ever heard of supply chain in hospitals or in health systems, this is what supply chain people manage, is all of these logistics, right? When we're running out of band-aids, who do we call? What do we do? When we had the PPE crisis, our personal protective equipment crisis during COVID, supply chain managed all of that stuff. I mean, they're probably stressed out, pulling their hair out over it because it was crazy time. But they're the people who had to figure all of that out, right? What do we do when we don't have enough lab equipment, when we need needles and IVs and saline and certain medicines and certain drugs and all of this stuff? You could work directly in that industry and be a manager, a supervisor, or whatever in that industry. You could even niche it down even further and say, oh, well, I want to do finance in healthcare, but I want to do finance in healthcare for a supplier, for a manufacturer. So that's just something that you can start thinking about of like now you start to see how big and how broad and how vast your options are because of all the different ways and different areas and different niches you could work in. And then honorable mention would be public health, number 7. Okay, this is for people who their heart is with the people. This is for people who they want to see the impact, right? They want to work super downstream. Hospital is like super upstream. You go to the hospital when you're feeling absolutely terrible. You don't know what else to do. You're not getting any better at home. You're going to the emergency room, right? Public health is like prevention. It's downstream. I'm sorry. It's opposite. Public health is upstream, I believe. Correct me if I'm wrong. The public health is preventative. It's, okay, how can we, in this area, there's a lot of air pollution. How can we decrease the air pollution so that the kids in this area don't suffer from asthma as they're growing up, right? They won't have lung problems and breathing problems and sinus problems and all that kind of stuff. That is what public health does. And so there's a lot of opportunity in public health for administrators to come in and really just increase the power of the industry, increase the leverage of the industry, increase the delivery of the industry. And public health is super, super important, especially now in what we do. And so, I have one more. Is policy and legislation. We talked about regulators earlier, how regulators are often enforcers. Legislation is what allows regulators to be enforcers, right? It kind of gives them that leverage, that power behind what they say, right? So an organization, like let's say California Department of Health Services can say, well, this is California law that you need to have X, Y, and Z in place. And if you don't do it, you're operating outside of the law, and there's tons of consequences for operating outside of California law. And so that's a very important industry as well. You can work in health policy. I have heard of even like health policy fellowships, which is like a postgraduate employment opportunity. So yeah, this is the full landscape of the healthcare industry. I hope that this helps you narrow down or at least have a better idea of what your options really are and where you can work. And I hope this helps. Let me know if you have any questions down below.